Scientists have hailed it as a major breakthrough in the fight against COVID-19. A trial led by a team from Oxford University has shown that the steroid dexamethasone can significantly cut the risk of death among the gravest cases.
This is the start of something important. It shows it is possible to reduce the inflammation and the outcome in patients with lung disease in hospital.
Dexamethasone reduced death rates by more than a third among patients who could only breathe with the help of a ventilator. For those receiving oxygen only, it cut fatalities by 1/5. It provided no help to patients who didn't require respiratory support. What makes the drug even more promising is its cost and availability.
It's been around for 60 odd years. It's very cheap. We've looked at the numbers, and if we treat 8 patients in intensive care with this drug, we'll save 1 life. And the total cost of treating all 8 patients is only about £40.
The steroid is normally used to reduce inflammation in patients, for example, with arthritis. The results of the coronavirus trial haven't yet been peer-reviewed. But the UK's Health Ministry has already approved the steroid as a COVID-19 treatment. It's introduced export restrictions and has been stockpiling the drug since March.
So we now have 200,000 courses that are ready to go, and we're working with the NHS so that the NHS standard treatment for COVID-19 will include dexamethasone from this afternoon.
There are currently no approved vaccines for COVID-19, which has killed more than 431,000 people worldwide. The EU and its partners will hold a conference at the end of this month. Their aim is to pool resources for jointly reserving future vaccines from companies, for themselves as well as low-income nations.
When it comes to fighting a global pandemic, there is no place for me first. Europe is not an island. Our economies are tightly connected, not only amongst themselves, but also with the rest of the world through global trade, travel, and cooperation.
Some medical professionals are skeptical about the dexamethasone study and are waiting for its full details to be published. But the fact that an already existing, cheap and mostly side effect-free drug has proven to be effective is boosting hopes that deaths can be reduced until a vaccine is found. Sibel Karkus, TRT World.
Well, let's bring back Dr. Andrea Feigl in Washington for more on this discussion. Hi, Doctor. Finally, some good news in this pandemic. The cheap and relatively accessible steroid dexamethasone appears to be a life-saving drug for those patients who are the sickest with COVID-19. How significant is this discovery? And tell us more about what UK researchers found.
Thanks again for having me back. And yes, you're absolutely right. It's definitely more than just a silver lining. It really gives us hope that we can help those that are most severely affected by COVID. So as you mentioned, dexamethasone helps those who are on ventilators already on oxygen treatment. And it is fairly cheap, around $30 to $50 in order to save a life. And hence it's very cost effective. That being said, it's not an effective measure for those who are not in the ICU yet.
Interesting. Okay. And we all know, of course, of the phrase that prevention is better than cure. But as the world waits for a coronavirus vaccine, what role could effective treatments like perhaps dexamethasone play in letting people resume their normal lives before an effective vaccine is found?
I think we need to also look at other treatments that can provide symptomatic and earlier relief, because we want to prevent as many people as possible from needing oxygen or being on ventilators. So using masks, testing, tracing, isolation, social distancing will still be a way of our lives until we find complementary drugs to dexamethasone that can help intervene and reduce symptoms and worse outcomes earlier.
Now, we heard there from the European Commission President Ursula von der Leyen. She was calling on world leaders to cooperate to buy bulk quantities of a potential COVID-19 vaccine to avoid harmful competition as the race heats up to find a shot that might prevent this disease. How important is it that rich countries really allow poorer countries a similar access to any future vaccine?
Absolutely. Pooled purchase agreements are very key here for public health. That goes for the access to treatment for poor populations within rich countries and for access to treatments in those countries most affected. The health of those in high-income countries is only as good as the health of those in low-income countries, given this highly infectious disease. And further, these pooled purchase agreements can ensure that those who need it most can get access to it in an affordable manner and when they need it. As we know, this virus spreads so fast, and putting these agreements, financial agreements together is really key here.
Sure is. Okay, Dr. Andrea Feigl from the Health Finance Institute, thank you so much again for sharing your thoughts with us on